All right. So Chris, being our last attendee to introduce herself, actually lends itself really well to this program because her and I started talking about spina bifida and healthcare with our conference committee almost a year ago. We were noticing that there were some critical healthcare needs after individuals and families living with spina bifida were home, utilizing telehealth, really sedentary, losing in-home care and aid services, not going to in-person therapies, PT. And ever since then, we have been actively providing programs that focus on getting health in the homes of individuals living with spina bifida. This started with a wellness month during October last year, where we did some self-care, a urological update. We did some workouts and adapted fitness overviews. Come February, we did a 30-day wellness challenge, which I partnered with Jean on in Greater New England, which was amazing. And in April, we had our virtual conference covering neurosurgery, orthopedics, urological updates, and mindfulness and coping skills. And, you know, fast forward now, we're in June and our focus is on skincare, especially with the considerations of summer and the fact that some of us are still more sedentary and more isolated. And what's the best way we can protect our skin? So that was how this program originated. And I really am just so thrilled that we're able to offer this. It's something that comes up, I think, in the spina bifida community. Sometimes it feels like it's really chronic and often, and then other times it feels like it comes in waves. And lately we've had a lot of those waves coming in of individuals of all ages living with spina bifida being impacted by wounds and having different experiences, and some being really critical and causing some really bad infections, and others being minor but requiring longer hospital stays than someone may want. So I reached out to our National Spina Bifida Association and said, I love this Did You Look series. I think the brochures are so important. I think this information is so important. I want to talk about that, but I want to be able to integrate some presentations and have some speakers share information and resources on this with the community so they can ask their questions directly and get some individualized answers. And we were lucky enough to have a bunch of incredible providers respond and say, yes, we are interested. This is something we're very passionate about. So that leads me to introduce our two speakers who I didn't call on before to save them some time now. So with us, we have Pat Byrewalters and Jennifer Wilhelmy. I hope I said that right.
Jenny, you want me to go first and introduce myself? Okay, so I'm Pat Byrewalters, and I had been the coordinator at the Spina Bifida Clinic in Detroit, Michigan for 15 years. And during that time, I got very involved in activities in the Spina Bifida Association. We actually had our first education day in 2001, and the National Education Days that SBA does now kind of modeled it after us. It was like a 3-ring circus with parents in one room listening to speakers, kids in another room having a total party, and vendors out in the hall with equipment and catheters and just educational material. As well as running the clinic, I got involved with the Professional Advisory Council, put together our application to become part of the National Spina Bifida Patient Registry. So our clinic was part of the registry, and ended up co-chairing writing the guidelines. So all those 25 chapters, I helped Brad DiCiano and others write that, put that together. So it's been a lot of fun. And in the midst of all that, although I decided to leave clinical practice and go to a full-time teaching position back home in Minnesota, Minnesota's home for me, the CDC and the SBA said, can you take your projects with you? And I was like, yeah. So one of those projects was Did You Look? And it's been really fun to work on it, and I'm excited to tell you more about it. All right, Jenny.
All right, thanks, Pat. So I'm Jenny Wilhelmy. I am a nurse practitioner at Gillette Phelan Adult Clinic in St. Paul, Minnesota, and my 50% of my clinical practice is seeing individuals with wounds and helping to treat them and look at their equipment and all of the stuff. So I really have become passionate about prevention and about treating things early before they get to be serious. And so Pat and I met at some of the national conferences when they were happening throughout the country, and then together did work on the Did You Look series. So we use that in clinic for education and screening, as well as kind of share that message throughout Gillette, so that if you're seen in a different clinical pathway by orthopedics or by urology or by neurosurgery or in our spina bifida clinic, that they can send referrals to me then to help with kind of the wound care and pressure ulcer prevention work. So it's a pleasure to be here. I'm super excited. It's kind of have to dust off my hat. It's been a long time since I've done any presenting, especially throughout COVID. So hopefully it'll be seamless. So welcome everybody. We'll pull up the slides, get going.
And just, sorry, Jennifer, just gonna say one more thing.
Yep.
If you guys have questions, please feel free to shoot them in the chat. I will be monitoring that. And I've talked to Pat and Jen, and if we need to, take pause and ask questions right away, we'll do so. Otherwise, I'll save them till the end. You can chat me privately if you want your question to be asked anonymously. And you can also use the chat to connect with others and talk to each other throughout this event. So please do network and ask as many questions that come to mind. All right, now I'm done.
Perfect, awesome. Well, Did You Look is our kind of tagline. We talked about a lot, but Did You Look is kind of the most important, and knowing that, healthy skin really starts with you and with that look. So that's kind of what we're going to talk about throughout this whole visit. In looking at our objectives, we really want you, to be comfortable with looking at kind of the common risk factors. What is the most important things to talk about that could lead to some type of skin breakdown? We're going to talk about a few really easy things to maintain healthy skin. Our goal is really that checking your skin is going to be as common as brushing your teeth. So if everybody brushes their teeth in the morning and at night usually, or you should. And so we want you to check your skin at those times as well to look for any areas of breakdown or redness. We'll have you be looking at at least three protective strategies, and then we'll show you some of the cool things that I think some of you have already seen in the Did You Look campaign. Pat, I think you're on mute.
Then go back, sorry. All right, we'll try again. So the big question is there a skin breakdown issue in spina bifida? And you can see from the two studies that I've listed here, it's the second most common primary diagnosis in spina bifida admissions. There are many complications related to wounds. The prevalence in adults with spina bifida in one study was reported at 34%. And as you see, as we go through this lecture, sometimes it's even higher, sometimes it's lower. But across the literature, the annual prevalence rates go anywhere from 15 to 77%. So we know, and you can probably tell us too, that it's a huge problem. The costs of it are ridiculous. These studies show anywhere, some of them looked at individual costs per patient. The last study there from AHRQ ranged from 20,000 to 100 and over 150,000. Dr. DiCiano, who some of you may be familiar with because he's very involved in the Spina Bifida Association and also co-chaired the guidelines, did a study that looked at the hospitalization costs like over a 2-year period to be over $364 million. And then the top bullet, 22% prevalence in children. So it's still a huge problem no matter what age we're talking about. And those cost factors that I had there don't even address the things like how much work did you miss, and what was the burden of care on other family members. So all those things are factors as well. And then from the National Spina Bifida Patient Registry, we looked at data on pressure ulcers. I was part of a study looking at that in 2015, where we explored factors associated with pressure ulcers. So we wanted to know who and why are getting these pressure ulcers. So we identified actually 7 factors, and you can keep a tally on whether or not you have any of these. One is the level of lesion. So the higher the lesion, the more likely it is that you will get a pressure ulcer. Wheelchair users was another factor. Urinary incontinence of any degree is a factor. Having a shunt for hydrocephalus is a factor. Having above the knee orthopedic surgery, and that might be like a derotational osteotomy, a scoliosis surgery, hip surgery, any of those also increase your risk. And any recent surgery, doesn't matter what the surgery is for, but any recent surgery is also a factor. And then those of you who are men listening to this will like this. The last factor is that Y chromosome. So being male is also a risk factor. So from the registry data, we also saw, and that was looking at over 3,000 patients with at least one annual visit, that 26% of those patients, so that's like a pretty high number, that's 1 in 5, were reported having had a pressure ulcer. Just in the past year, almost 20%. So of the people that I see in a clinic, just think 1 in 5 of those walking in are probably going to have a pressure ulcer within a year. Oh, sorry. Okay, so if 1 in 5 of our patients has skin issues that may be preventable, how do we reduce their odds for developing those skin issues? And that's how we came up with this work group. And you can see that both Jenny and I were members of this work group. We met, I think it was monthly for a very, very long time as we began to consider how do we get the message across that this is a significant issue that we know you can prevent. So we found that collaboration is key. We talked to patients and their families. We worked with the Center for Disease Control and Prevention. We talked to Spina Bifida clinics. We talked to other healthcare professionals. And of course, we worked with the Spina Bifida Association. So we came up with that very sassy title, Did You Look? Because oftentimes when I would be in clinic going to see a patient, I would say, did you look? Meaning, did you check your skin? So our Did You Look program, I don't know if I should call it a program, Did You Look campaign has 3 components. The first is a modified Braden. And the Braden scale is used widely in hospitals to measure, and nursing homes, to measure the risk that patients have for pressure injury or skin breakdown. So our modified Braden is a risk assessment tool that's used in the clinics. It's easy to use. They let us modify it for our Spina Bifida population, and it can be used in pediatrics and adults. And this is what, how we divided ours up. So we made red zone, meaning yikes, you're at risk, yellow, slightly less at risk, or green, probably minimal risk. And if you look at the red zone, it looks at 5 different categories. One is sensation. So can you feel your sitting surface and your legs? Do you have any incontinence or moisture? What is your mobility? So if you're a wheelchair user, or even if you're not a wheelchair user, but you have impaired sensation on your sitting surface, how much do you wiggle around? I always told my kids in clinic, jiggle, be a wiggler, because it's very important in trying to reduce the risk. And then friction or pressure. Do you have constant pressure? When you transfer, do you drag yourself across a surface, or do you lift your butt up off the surface and move over that way? And then having skin breakdown in the last year is also a risk factor. Component 2 is physical assessment. Skin inspection by a healthcare professional is recommended at every visit that you go to your clinic or into the hospital for anything. Jenny actually did a study, and very informal study in her clinic, asking people when they came in, do you have any skin issues? And 50% of the people denied wounds when questioned, but found that they had wounds. So that's a pretty significant number, and again, reinforces the need for us to look. And then the third component of this Did You Look campaign is education. So prevention starts with a look. And this is on every brochure. We look at signs of trouble. We look at things that you need to do or not do. You need to avoid pressure. You need to eat and drink right. You need to do daily skin checks. Try to, if you have incontinence, change as soon as possible, and act quickly if you see any areas of redness. Jenny, I'll let you take it over.
Perfect. So in looking at kind of the things that Pat has talked about, the things on the sheet and in our campaign, these are kind of those 6 top things that put you at risk for skin breakdown. And we'll kind of be reiterating these as we go, but poor absent sensation, incontinence or moisture, inactivity,
Jen, I think you muted somehow.
my computer is possessed, I guess. So heat, poor nutrition, hydration, and then overall physical condition. So we'll kind of break this down and look at what it looks like in each of these areas as we go through. Next slide. So impaired sensation. We all need to take a peek at our own bodies and help our children if we're working with kids. Look at how good is your sensation. I like this little grid. Other clinics use different things to market, but for some folks, they really need to document, like, what are the areas that I either can't see or I can't feel. And so, yes, if you're an adult, this looks a little kiddish. We can make it look more adult for you or customize it. But looking at pointing to those areas and marking them down so that if you have caregivers that are coming in to help you, family members, PCAs, they would be able to say, these are the areas I have to pay particular attention to because you can't see that area or you can't feel that area. Even a light touch, a pinch, pressure, change in temperature or pain, you know, it really depends on where the level of your lesion is and how that impacts the skin in that area. So this just gives you an idea of kind of how to document that or put a little chart in place to help you identify those areas of impaired sensation. Next slide. Skin checks every day. My goal would be twice a day, morning and evening when you brush your teeth. Because if we can find and act quickly on areas of redness before it becomes a blister or a sore or a crack, it just heals that much faster. And so looking for the areas of skin that you can't see, feeling for any areas that are hot or moist, using a mirror. These are 3 things, the mirror is important. I've had a lot of patients, strategically put mirrors in areas so that when they do transfer, they can lift off their seat and be able to see the backside of themselves in the mirror. AFOs can be trouble or bracing, making sure it's fitting well, that there aren't any rough edges or broken straps. And then the shoe in the middle is just kind of highlights checking your footwear to make sure that you don't have just one rock. Most people don't have a shoe filled with rocks, but this just shows that. But if you had a little rock or a nail or something in the bottom of your shoe and you don't feel your feet, I've had many patients then slip on those shoes and end up with a wound from that. So it's making sure that not only are you wearing the best footwear, but that you're checking it to make sure nothing got trapped inside there from the day before. Next slide. The second risk factor, looking at incontinence or excess moisture. So if your skin stays moist, whether that's by perspiration or urine or incontinence from bowel, it is more likely to break down. And so I like to tell patients, think of your skin like a sponge. If you bought a dry sponge at the grocery store, it's pretty firm, it's hard to pull apart. It just is kind of a consolidated sponge. If that sponge gets wet in the sink and you start water running over it, the wetter it gets, the bigger it gets, and the more it tends to fall apart. And your skin is a lot like that. If your skin gets moist for too long, I think about when I was a kid and stayed in the bathtub too long, it gets kind of pruny and shrivelly. That hurts the skin integrity. So if it is constantly wet, it'll put you at increased risk for wounds. Plus, moisture and bacteria can change the chemical balance of your skin and also put you at risk. So making sure that your skin is kept clean and as dry as possible is super important. Next slide. So we recommend that you wash your skin every day and as needed. So if there's an accident that occurs, making sure that you're washing up with soap and water, checking the temperature of the water. I've had patients in clinic with especially foot burns from putting their feet into the bathtub before they check the temp with the thermometer. Soft towels to dry all the areas, especially in between your toes and the bottoms of your feet. In between the toes is just like a perfect storm for fungus and skin breakdown because it gets moist and can be problematic. And then okay to use a moisturizer on your skin to keep it good. Just don't put it again between your toes because we don't need to add any moisture to that area. So good hygiene is important. It's also important because people like to smell good, feel good, be good, when you're dating or have a significant other. And so we all need to make sure that we're washing and keeping our skin as clean as possible. Next slide. So risk factor number 3, inactivity and mobility. I think the pandemic has really brought home for us that we can all be even more sedentary than we thought because we were all kind of trapped at home. So looking at how much time you spend in bed or in a chair or in your wheelchair, really inactivity can lead to increased skin breakdown. So making sure that you're moving. You can see that throughout this, my body, because I have sensation, is sending me signals to move. But because you're not feeling the skin that you're sitting on, there's a possibility then that you're not going to get those kind of internal signals to shift. So a lot of the folks that I work with have to set a timer, use their smartphone or their smartwatch or computer to set a timer every 15 minutes so that they're shifting around, especially when we're doing things like watching a movie or hanging out with friends. Time can go quickly and all of a sudden we've been sitting in the same place for a few hours. So making sure that we're moving around at least every 15 minutes and then getting active. Making sure that even if we can't get out to the places we're active within our homes or within our yards, if you're fortunate enough to have a yard, but even just doing push-ups, to get your butt off the seat, to relieve that pressure can be important as far as reducing that risk of inactivity. Next slide. Risk factor number 4 is heat. Checking the bath or shower before you get in. I have a little bonfire there with some marshmallows. It's summertime, time for campfires. I've had a few patients that have sat too close to the campfire. So if they don't feel the skin kind of in their legs, especially the shins, they sat a little too close and ended up with burns on their shins from the campfire. And so making sure that you're a safe enough distance away to make sure that you don't get burned. And then, playground equipment, curbs, picnic tables, checking the temperature of those before we're sitting on them, because that can put you at risk of burns. And avoiding walking barefoot outside, not only just for the burn factor on hot surfaces, but rocks, pebbles, all of those things. And looking at the comments, sitting on a hot tennis court or pavement doesn't end well either. And it doesn't. That's a comment that we learned painfully with our furry friends, thinking that we were going to let them run on a tennis court one day, and they ran with their paws on that rough tennis court and took off the skin on their paws during that. So making sure that we're really aware of the surfaces that we're making contact with and protecting our feet. Because that really, even though you may not get that pain signal, the pain of taking care of that and getting it healed is going to be great. So avoiding sitting too close to a radiator in cold weather. Right now, we seem to be in that shift to really hot weather, so we tend to forget about the cold weather, especially in Minnesota. We're trying to let that go for a few months till that snow reappears. But the cold can do that as well. And we'll see that as we talk about some weather factors coming up in the future. Risk factor number 5, inadequate nutrition, poor hydration. Is your weight appropriate for your height? Do you need to look at your eating a better, well-balanced diet? People that are overweight are at higher risk for skin breakdown. There are more folds. There are more areas that can get irritated. And so it's important that we look at our weight, and we all need to be doing this to making sure that we're maintaining a healthy weight. Fruits and vegetables, healthy meals, 2 hours or less of screen time. I mean, this we made before the pandemic. So imagine what the pandemic has done to our screen time, just kind of blown that up as we're all sitting on a screen staring at each other right now. And then trying to be active for at least an hour or more throughout the day is super important. Next slide. And Pat, you may need to take over when you need to, because the slides aren't numbered now, so I'll lose track. But overall physical condition is super important. Attend to your needs. I found this picture on WebMD, which is a common website, but it really showed a lot of the young women and men that I'm seeing through the Spina Bifida clinic have trouble with lymphedema or edema of their lower legs. And this is kind of the shape that a lot of their legs take on. And so making sure that you're watching for swelling and taking action early when you do see swelling, talking with your healthcare provider, because it's much easier to treat swelling at the beginning than if it gets out of control and you need to go into a more in-depth process other than just compression stockings. Making sure that you're watching surgical scars for potential skin breakdown. And if you have any rashes, itching, open areas, contact your clinic to get help and support to get that, or let a parent know, or a significant other, or a PCA, push the help button, because the earlier you push it, the faster we can get you on the road to recovery. Next slide.
So we put together, as part of the educational efforts, a series of brochures. And as you can see, we want even parents of infants to be thinking about this. So the youngest or the earliest brochure is really geared for infants and toddlers. And all the brochures are age-based and set up basically the same way. And as you can see on the other side, it's still the Did You Look campaign. So the things that Jenny just talked about are all the things that we want you to be thinking about. And then we put in age-specific examples of how you can protect your skin at each age. So then we have also a school age one, and again with specific examples, one for adolescents and adults, again with specific examples. So now we've moved from things that parents need to be paying attention to things that people with spina bifida need to be paying attention to. Jenny?
So what are some of the skin protection do's and don'ts? These come a lot from the things we see in clinic every day and kind of go into a list. And they're somewhat repetitive to what we talked about, but I don't think we can stress enough some of these things. And so the next few slides are going to be the do stuff. These are the good things. Use your footrest for good alignment. This also keeps the pressure more evenly distributed and reduces the pressure at the back of your knee that can interfere with circulation. So you can see in my little cartoon man there, he is using his footrest. And it's super important because it really affects how you're seated in your chair, even though you think that kind of dangling legs is easier and helps for being able to transfer more easily. The purpose of the footrest is really helpful for positioning. Use your wheelchair and wheelchair cushions to distribute weight evenly. These need to be evaluated at least every year to make sure that the foam is still in good shape, that it doesn't need to be replaced, and as needed. So if you see a red spot showing up on your bottom and you have been sitting in your chair frequently, this is the time now to look at the cushion to see if it has any breaks in its integrity. Is the foam worn? But at a minimum every year. Loose fitting clothing on your legs. Sometimes tight fitting clothing can worsen edema because it's cutting off circulation. I've seen this especially with jeans, and at the top wearing a tighter fitting pair of jeans that are more rigid at the top of the waist so they don't fall down when you're transferring and moving into different positions. Unfortunately, the tightness of the jeans at the top can cause pressure in those folds and cause skin breakdown to occur. And then using a lap board when cooking is super important to make sure that you're not suffering any burns. We've had quite a few microwave popcorn burns. So grabbing that microwave popcorn bag out of the microwave, throwing it in your lap to get to the next location. Maybe it's a bowl you're going to pour it into in your kitchen, or you're taking the whole bag right to your couch for movie night. But the steam coming out of that, if you can't feel that skin, in the inner area of your thighs, significant burns have occurred. So making sure that you're using some type of protection on your lap when cooking. Next slide. Other do's: 5 to 10 wheelchair push-ups every hour to get yourself up and off of your seat. Being careful with transfers. I think an interesting thing I saw when I was looking through some of the research when I initially started doing this work is that people who can't feel their lower extremities, like their legs and their thighs, don't always acknowledge that it's part of their body or something that they can hurt. So when they talk to kids who are younger in their years and had them draw self-portrait, if they couldn't feel their legs, they didn't often include them into the drawing of their bodies. And so making sure you know that this is your body from head to toe. And when you're transferring, we need to protect your legs and your feet during the transfer. We can't bang them off of things because that's going to cause wounds over time. Checking the temperature of car seats. Car seats that kids sit in and car seats that you transfer into in your car. Minnesota's in the middle of a 12-day heat wave. And so we're finding that things that normally aren't hot that we're sitting on are really hot right now. Wearing long pants if you're crawling. If you're someone that crawls around the house, making sure that you're protecting your knees and your calves, and avoiding rough surfaces. Putting your feet up just to reduce swelling throughout the day, especially on those hot days. Making sure that you are, when you're laying in bed, you're putting your feet up on some pillows. And the important part of elevating your feet is that your feet have to be above the level of your heart. So if you're sitting in your chair and just put them straight out onto a chair, that's not going to reduce your edema. You actually have to be out of the chair onto a mat table or a couch or your bed with your feet up on pillows over the level of your heart to reduce that swelling. Highly recommend when you go to the doctor, take your shoes and socks off so that your feet can be examined for any issues, yeast or fungus or cracks or toenails that are broken. If you have your shoes and socks off, then people will pay attention to your feet to see what's going on. And then, call your provider, even if you have a minor injury to your foot, your leg, you notice any redness, even if minor, call your provider and get in to get that dealt with immediately. Next slide. Here's some of the don'ts, some of the things we've learned just in clinic. Don't put the hair dryer, the curling iron in your lap. This comes from real life stuff. So I'm going to quick throw this hair dryer. I just used it. It's hot. I'm going to set it on my lap, get it to the next place. That can cause a burn to happen. Don't put hot food, liquid, or plates in your lap. Don't get too close to fireplaces, radiators, hot water pipes, baseboards. Don't wear elastic bands at the waist and the ankles that are tight, because that, again, will cause skin breakdown. Crossing your legs for a long period of time, believe it or not, can cause skin breakdown, especially if you have edema there. Putting bare feet on hot or cold wheelchair footrests. So making sure that your footrest is a safe temperature. And then smoking and cigarettes and vaping decreases your circulation, which puts you at increased risk for wounds and skin breakdown. Next slide. Summer tips. Do you want me to keep going, Pat?
Sure.
Okay. Some of the summer tips, we really want to make sure people are drinking enough water to stay hydrated. It's super important. It's a hard thing to do. I myself have to force myself to always have my water bottle with me so that I'm drinking as well. Wear a hat, wear sunscreen. The most common place I see sunburn is the tops of your feet. So when folks are coming into clinic for their skin checks and have been out in the sun, especially if they're wheelchair users, they kind of forget to put sunscreen right on the top of their foot, and we see sunburn right there. Wearing bug repellent if you can to avoid insect bites, covering rough or hot surfaces before you sit down, wearing swim shoes at the pool and the beach. When we would have our national conferences together, this was like the #1 thing. Like, we almost needed to hand out Spina Bifida Association pool shoes, because pool surfaces around the pool and in the pool are made to be rough so people don't slip. But if you can't feel that and are swimming for a long period of time or on the pool deck, you're at risk for skin breakdown related to the roughness of that surface. And always dry your feet off carefully after you've been in the pool. It's super important. And it's not on here, but sitting in a wet bathing suit can put you at risk. So making sure that if you are enjoying the beach and stuff, you're getting dried off after you get out of the water. Next slide. Winter tips, making sure you're wearing socks, and again, footwear. I do have patients that come to clinic in the winter without footwear. So making sure you're protecting yourself. In Minnesota, it gets very cold. So you're making sure that you have protection from frostbite, long underwear, mittens, hats, removing wet clothing as soon as you come in, and checking your feet for any swelling or red marks, gray areas that could indicate frostbite. It's hard to think about now when we're in this hot summer, but protecting your skin in the winter is just as important.
So prevention is possible, and it starts with a look. Daily skin checks, look at all those areas. And as Jenny said, twice a day is best. Controlling moisture, avoiding pressure, eating right, getting enough fluids, and quickly acting on areas of redness. And it's a wrap. So now we can take questions if you have any.
Oh,
Yeah.
we do. And I'm actually going to kind of go in the order of the slides for some of them, if that works. So I'm actually going to share and I'll kind of guide it as we go, if that works for everyone. Awesome. So question I had for you guys. Oh, come on. Was the Gillette Skin Project. So 50% of people denied wounds when they were questioned, but were found on skin inspection. I know it was more of an informal study, but do you know of what contributors, or if there were contributors that led people to say no? Was it that they didn't know skin checks were important, or they couldn't see? I'm curious if you knew of any contributors to that.
Sure. So I think the biggest thing is they didn't even know they had a wound because they were living more independently, did not maybe have a buddy that could help them to check areas that they couldn't see or feel, or have a mirror that was located kind of shortly after this. We did a bigger project with mirrors, you know, to trying to connect people to have mirrors to look at skin. But I don't think there wasn't any person in there who didn't want their wound looked at. They just didn't know it was there. And so they were not aware because they couldn't feel it or see it.
Thank you. Then there was, are you able to share this grid?
Yeah. Yep.
Okay.
I'll try to find it in a better thing, and there was, Pat and I can talk. I swear there was another organization that had almost like a superhero diagram that they used too, that we've seen at a past convention to another one of the children's clinics. And it's escaping me which one that was, if it was nationwide or one of those, but yeah, we can share that.
Yeah, I loved how you talked about, you know, even if there's spots you can't see, if you can use this chart and identify those, then you can really sort of advocate for yourself within your support network to get some quick and easy assistance with it if you're doing it regularly.
Right, because the other thing I'm kind of finding is that sometimes folks don't know how to talk to their PCAs or their caregivers about how to help them. You know what I mean? They have them, they come into their homes and help them, and it's, you know, it provides socialization, but talking about looking at my skin can be really a hard conversation to have. And so we kind of try to look at strategies for how could you have some of those difficult conversations so that you can get the support you need and have your body taken care of in an appropriate way.
And sometimes with little kids, hiding a sticker and making them find a sticker using a mirror or, you know, other ways of just like looking at it is a good way to get them to think about the need and importance of doing it.
Thank you both. So kind of touching on that, do you have any other recommendations if you can't see far enough, and you know, when you can't see those places, they're too far, but you need to be looking at them daily? What else do you recommend? I know we mentioned mirrors, utilizing support. Are there other recommendations, or does that cover it?
Certainly touch, right, Jenny? But also I think everybody has a phone now that take a picture, and your phone can take videos or pictures in places that you can't see or can't really like get to with a mirror. So it's another tool.
Right. Although we never recommend posting those on social media or other avenues. So okay to send to your healthcare provider, not so good for Facebook or Instagram, just saying.
And I'm not sure if you guys know, but is there a place for storing that in the app for the Guidelines to Healthcare app? I know they have symptom trackers, but I wonder if you'd be able to track pictures of your skin there.
Yeah, I'm not sure. I'd have to look at that.
Either, yeah.
I would too, yeah. I try and use that app as often as possible, but.
Right. And we've tried to develop some ability of our patients to send photos to our telehealth nurses. You know what I mean? So that they can then share them with us to be able to know, like, how urgent is your, do we need to get you in today? Do we need you to go to the emergency room? And so we've been trying to develop more ways. Our portal's not very good yet for our patient, like our patient clinic portal, but kind of work. A picture can tell 1,000 words, you know what I mean? It's just great when you can see that so that we can know what the sense of urgency is.
Yeah, absolutely. All right. I'm not sure if I know how to say this, but is comaceptine ointment a good ointment for skincare?
It has zinc oxide in it. It has petroleum jelly in it. It has a menthol in it. So I would say that it varies on what it can be used for. Jenny, do you want to chime in there? I would say, any petroleum jelly or petroleum-based products are helpful if you have incontinence.
Yeah. I personally find it a little thick to use, like on a daily basis. I think of it more as something to treat kind of a red irritated area from incontinence with, but any barrier, like Pat said, that contains petroleum or dimethicone, which is another product that you see in barrier creams, can be useful in protecting your skin from absorbing incontinence. So Calmoseptine just seems to have gotten to like every possible conference and free handout. So a lot of people have access to it. So I feel like go with what you have access to. But you can use a very, very thin layer. You don't need much of it at all. You probably, one of those tiny packets from the conference will last you a couple weeks. So yeah, thin to win.
I had a social worker in clinic that used to say she loved it for when they got colds, because you could put a mustache swipe and the menthol would, clear your sinus passages and protect your skin from a runny nose. So has its usefulness.
Thank you. What can I do to help the thin skin on my leg that I can't feel? How can I make it tougher to withstand a compression stocking so I don't get a sore?
So I think for me, it's making sure that you're being fit appropriately for the compression stocking. So making sure that you're seeing an expert who does measurements of your particular leg and decides whether or not you need like off the shelf, we call them, compression stockings that are just a standard size. A lot of my patients with spina bifida need custom compression stockings. So compression stockings that are measured just to their individual legs. I don't see a lot of products on the market to make skin tougher. It's more about protecting it, you know what I mean, and keeping it free from pressure. And so it's hard to recommend a product that would do that. But the right fit for a compression stocking and having it measured expertly would help to reduce the risk. And then, of course, making sure if you do wear compression stockings that they are put on in the morning before you get up and get going, and they're taken off before you go to bed. So some of my patients come in wearing them for days at a time, and that's not a safe practice. They really need to be on in the morning before you're up and that swelling starts, and off before bed.
And I'm sorry if you said this, but who would the expert be to fit for a compression stock or compression sock?
So in our clinic, it's the orthotist. So the same person that fits your braces is the person that can take measurements to size you appropriately for your compression stockings. Plus there are different degrees of pressure stockings, different millimeters of mercury. And so you really want to work with a healthcare provider to make sure you're in the right level of compression, and that then work with an orthotist to make sure it's measured and fit appropriately. Especially if you don't feel your legs. You know, some people could maybe order them off the internet, off Amazon, and be okay. But if you can't feel where those increased areas of pressure are, that's kind of dangerous to do.
our orthotist did too. So.
Thank you. Thank you. All right. This was one that sort of triggered a question about sort of the complexity of spina bifida. Be active, but if you sweat, you need to be careful, and things like that. Swimming's good for you, but you really need to be careful in and around pools. When it comes to addressing those nuances of managing all the comprehensive needs you have with spina bifida, and luckily too, there is that overlap. Being active is good for managing so many aspects of your health, kidneys, etc. So it seems like, yes, this is the way to go. But I started to wonder, do athletes have issues with these sorts of skin breakdown, wounds, etc.? And what are some of the strategies for addressing those nuances of being active but being careful?
So one of the world's most famous wheelchair basketball players had an issue last year, and he was very public about it. He has spina bifida, and what it came down to was that he didn't look. So first thing is, did you look? And then when he did, he postponed getting help because he didn't want to miss games. And he ended up missing months and months and being hospitalized and, developing sepsis and almost dying. And, so it's something that you absolutely have to address right away.
Right. Yeah, I completely agree. I've had Paralympic athletes in my clinics, with wounds, and you have to look at your sporting equipment the same way that you look at your everyday wheelchair. You have to have enough pressure relief. You have to be checking your skin before and after. You have to be, drying your skin well after you get out of the pool or those kind of things. But it does seem overwhelming, but it really is manageable. And sometimes it just takes someone to help you kind of make a cheat sheet of what you're going to do every time you participate in that activity. But it affects athletes at all levels. We've had pretty much all levels of athletes in clinic with different types of skin breakdown, whether that be pressure injuries or burns or rashes. And that's why if you ever come to clinic for a wound appointment, it's almost like we put on a detective hat and we start asking you about all these areas of your life that you're like, how does this apply? How does this apply? Because I want to know everything your skin is touching from the time you wake up in the morning till the time you go to bed, so we can make an impact on what piece of equipment or what type of treatment might be affecting your skin integrity.
Awesome. Sorry, I am writing down all these wonderful questions that are coming in. And just one more thing about, the activity. I know one of the other considerations was about being in your, sitting in your wheelchair and using your footrests. I think that was here. Does flexibility become a factor here when some people have a harder time maybe bending at the knee and bringing in their foot to sit on their footrest? They have any tension, hypertension, etc.?
Yeah, and I think that unfortunately really affects kind of what resources you have in your community. I am very blessed by the fact that I've got a seating team with me in clinic every single day. And so I know everyone doesn't have access to that, and I'm sorry for that, but we really work creatively together to try to make it work in multiple different situations. So it may not work with the off the shelf, your vendor says this is the only thing that comes with this particular wheelchair, but trying to get yourself to an expert that can help you maybe creatively think about better positioning is really essential.
And if you don't have a seating team in your clinic, I was also blessed to have one in my clinic. We would sometimes see patients who were referred to just the seating clinic. and that was usually the seating specialist, a physical therapist with expertise in that area, and sometimes our wound ostomy and continence nurse.
That's great. And actually, I didn't realize how relevant our, when we still have more questions, but part 2 of our program is equipment considerations, seating and bracing. So that'll be really good to talk to those folks about, local to us, but also local or nationally known. So I think that'll be great to harp on that a little more. And I did want to also just touch on, I liked that you mentioned, Jennifer and Pat, about starting with kids and sort of having a checklist where, something I notice is Kathing's like clockwork. When that routine is instilled, I'm not sure that people are thinking twice about that. So how do we get parents and adults to make that a part of their routine naturally, where it just feels like everyday life? I really liked that point. So I'm going to lymphedema, and I know it was mentioned here. How do you prevent cellulitis when you have lymphedema?
This is outside of my normal area of expertise. So if a patient comes to clinic and they have lymphedema, I refer them to a lymphedema expert or a clinic. Those are usually run by physical therapists in Minnesota. So I don't know how that translates, to New York and throughout the country. But I think controlling the edema and following their care plan will help to minimize infection or cellulitis, because your skin won't be under so much tension from the swelling, that it can create breaks in your skin, which put you at risk for infection. So, and again, it's starting early when you first notice those changes or signs of swelling, not waiting until it's very swollen, to take action, because there are many things that can cause swelling in your legs, not just lymphedema. And so if you notice swelling in your legs, seek medical attention right away.
And I think, everyone is coming from different areas. And so not everyone does have that clinic, but you can contact your primary.
Yep.
You can
start with the primary. That's the best place to start, because they'll help to kind of guide that.
Yeah. And for, the adults who don't have a primary because there isn't one available, contacting your local chapter or state chapter or the National Spina Bifida Association. Again, I reached out to the National Spina Bifida Association and got connected to providers I didn't even know existed, because we haven't had that local expertise really around as much when it comes to spina bifida and skin health. So there's a lot of resources too, and I would hate for someone to say, well, I have no doctor to go to. There will always be someone who can, in the spina bifida community, that will want to be able to help connect you with the right provider, the right resources and information. All right, next question. What is the relationship between shunts and skin breakdown and pressure sores?
There isn't a direct relationship. It's just that patients with shunts may be at more risk to just attending to certain things. You have a lot going on, so it's just another factor, another piece of your spina bifida that may impact some of your decision making and memory. Not everyone is going to have that, who has a shunt is going to have that as a risk factor. But
thank you. What can you use on a wound that is healing and now is a callus?
So it's hard to, without seeing things and to know exactly what's going on. But generally, a callus is still your body's way of showing that it's under pressure. So if that callus is happening under a brace or under some type of equipment, you want to still look at that equipment or that brace and get additional pressure offloading. So callusing is just, the body's way to show that it's under pressure. So some people will seek out, different clinics where they'll be able to pare that back, and do some different topical treatments, to help those areas. But I can't think of anything at home, that I would recommend safely for people to do to treat the calluses on their own. I'd seek medical attention.
This might be similar, but is there a ointment that is best for treating wounds?
Sorry, Pat, not trying to hog the show here.
No, I'm just sitting here shaking my head. So go ahead.
Yeah. So really and truthfully, every wound that comes into clinic is different. And I really have to lay eyes on it and look at it. And sometimes I joke that, you're kind of like the wound whisperer, you know what I mean? I kind of whisper to it. I see how much drainage it has. I see what the tissue looks like. All of those factors go into what the treatment plan will be. So unfortunately, there's not a one size fits all, like everybody heals with such and such cream. In fact, the bigger issue is removing the pressure or removing the reason for the wound than actually what you treat the wound with. Because I could have this super fancy dressing and put it on a wound, but if I haven't gotten to the bottom of why the wound's happening, it's not going to heal. So it's really doing that detective work to figure out what's making the skin break down.
And location is a huge part of that.
Yep.
Right. So many factors, as always.
I know. I wish I could make it that simple and just say, if everyone went and bought this, the wounds would be gone. Pat and I would be in the Caribbean somewhere, like retired.
I think we all would.
Yes, we would.
Go.
Yep.
Amazing. So I'd like to learn a little bit more about, how your clinic functions and, is it performing skin checks? Who's responsible? When does it happen? And at what ages?
So Jenny, I can just address how we did it in our clinic. And that was the wound care nurse always did the skin checks, but also physical medicine. And if it was extremities, then obviously, especially if it was a child who had braces, then the physical therapist would often check too, and sometimes the orthotist. So it was really a multidisciplinary approach. And in a very busy clinic, you might put a note on the door that said, because we had like 10 team members that would see comprehensive visits, put a note on the door that said skin checked and okay. But oftentimes you were looking at, areas that were at risk for different reasons. So, but somebody in the clinic should be assigned to that.
At Gillette, our physical therapists work with all the pediatric patients to do this as part of the Spina Bifida clinic. I have noticed that some of our adult skin checks in the adult clinic have lapsed with COVID. So that has just been something that we're starting to pick up again. But we had a robust program with Did You Look when it first came out and looking at everybody's skin. I have a really solid partnership with the nurse practitioner in urology, and we often work across the desk from each other. And so she makes it her mission too to be checking skin and then referring as appropriate in all the urology visits. And often we see similar patients. So we're building up that robustness again. But again, it's a multidisciplinary team effort.
I really love to hear that too, because it's great to have more than one eye on it. And I think we know too, with spina bifida, more than one reminder never hurts. So that's a really strong approach. And I'd be, curious to know clinics that are doing this versus clinics that aren't, I guess they might not be treating it then, but I wonder what outcomes would really look like.
It's the next phase of our Did You Look project, is to look at the data from the clinics that are using it versus those that aren't, to see if this actually is an effective campaign.
Oh, that's amazing. That's amazing. And I think I mentioned at our conference in April, we brought this up to our clinic providers and are starting to hopefully incorporate skin checks into our pediatric and adult clinics, to remind all the healthcare providers, as well as the patients or individuals with spina bifida and their family members, this is a daily need, something you want to look at every day. I had another question, and this is actually from me, because I feel like we've mentioned a few really important tools or equipment pieces that can help support your skin. So one being mirrors. We talked about, pool shoes. I think something about mirrors too is we found these telescoping mirrors that can assist with going down and looking at feet without causing additional strain. And handheld mirrors too can be found on Amazon and are within relative cost, between $20 and $30. So again, not being able to see the bottom of your feet, that could assist with some of those tougher areas to get that mirror on. But I'm wondering what other equipment do you guys know of that supports skin health that you may suggest to an individual or family to assist with protecting their skin?
We talked when we started this campaign about, is there a way we could buy those telescoping mirrors for everybody that needed them? But unfortunately, we haven't found the funding for that. But I don't know. I can't think of anything else. Pool shoes.
Thermometers for the bathtub, even if you get the ones, that kind of float around in there so that you can check the temperature before you get in. The dollar store can be another great place to find, if you have the dollar store. I don't know if I'm assuming they're nationwide, but to find mirrors that are pretty affordable, handheld mirrors. The other thing that I have been doing at home with one of my teenagers a little bit more too is just getting like an expo marker, which is a marker for a whiteboard, and writing messages on the mirror to remind her of things. So making ways within your life that are simple that can help you remember kind of those key things. So if it's in an area where you always get dressed, maybe making yourself a cute little sign or a cute little reminder that says, check your skin, or did you look? Or just a giant pair of eyeballs, that are cut out of our presentation, just something to kind of trigger my memory. And so I'll leave her little messages in the morning because she wakes up long after I'm gone. And I know she's going to go to the bathroom every morning and then see that this is what she needs to do for the day. So just trying to find those kind of things.
I might try that with my husband.
I love that. Just in the comments, someone mentioned the padded toilet seats can be helpful for, your continence routine.
Yeah, you can imagine that the typical toilet seat was not designed for a 1 or 2 hour bowel program. You know what I mean? So if your bowel program is taking time, we fully support that it's important to do a bowel program, but look at the equipment that you're using and maybe protect your skin during that time.
And then Lisa mentioned, I got a telescopic mirror through my insurance company's online pharmacy store.
Nice.
Oh, and Shamika loves her foot massages to help with checking skin. So who wouldn't, right? And then the last thing I wanted to ask too comes from me, and it was actually from a conversation we had when we were getting ready to work together on this program. And Jennifer, I think it was you who said, if we catch it when it's red, treatment's going to take this long. And I don't know if you touched on that, but it was really impactful for me. So I just wonder if you could sort of summarize that again.
Sure. I mean, most of the stuff that I see in clinic is pressure related. So it's considered a pressure injury. And there are 4 stages of pressure injury. And I know you guys are going to have a wound nurse talk about these things, but stage 1 is just redness on the skin that it doesn't go away. You take off your brace and that redness stays, you know what I mean, longer than 15 or 20 minutes. If we can remove the pressure at that time and modify the brace or change something about what you're doing, that could heal relatively in a few days. A stage 2 pressure injury and 3 and 4, when we get to 4, we're at like bone, you know what I mean? So we can see bone. And I have had patients sadly come to clinic for their first visit, and they seem to have gone from never noticing any redness to bone. So they've kind of come all that way. We're looking at, if we're lucky, a year in healing to get a full thickness pressure injury where we see bone or muscle. And that's a year of maybe not going to the beach to swim, or not going in your favorite pool, or missing out on work, or those kind of things. So if we can catch things in that redness stage and make a change in our course, like we're driving down the road, we see red, okay, now we're going to make a right-hand turn instead of going straight ahead. That right-hand turn is going to save you guys just so much time, money, energy, worry. And, you know, for some people, pressure injuries and other skin issues can be life-threatening. So we just really want to try to help you make that turn when you see the red, instead of waiting until it's a hole or a pothole in the road.
Awesome. Well, that covers, I believe, all of our questions. Yep, that covers them all from what I can tell. So thank you both so much for your time and your passion towards this incredibly important need, for being a part of getting this information out there and continuing to expand on this information. It's a huge resource for our community.